Good morning to you all and to all of those who make this broadcast possible every morning. As usual, we're going to give you an update of the international and national situation regarding COVID-19. Taking a look at what is happening in the world, we still cannot see the light at the end of the tunnel, as the saying goes. A total of 182 countries were reporting COVID-19 cases. The total of confirmed cases currently stands at 2,431,890. That is 76,037 cases. There were 5,200 fatalities in the world, for a cumulative total of 169,859 deceased people, for a worldwide lethality of 6.98%. Likewise, the region of the Americas reports 934,355 confirmed cases, 35,304 more than yesterday, and this represents 38.4% of the total number of cases in the world. The region is also reporting a cumulative total of 49,600 fatalities, with 2,236 in a single day, for a lethality of 5.31% higher than the one reported yesterday. A total of 12,137 visitors remain in Cuba. Of them, 7,050 are Cubans who reside abroad, and 5,087 foreigners. In rental houses, the data remains almost the same, with 953 foreigners who are mainly concentrated in Santiago de Cuba and the municipalities of Plaza, Playa, Centro Havana in Havana. A total of 3,425 patients have been admitted to the Cuban hospitals, 36 patients under surveillance, 2,583 are suspected cases, and 806 are confirmed cases. We're keeping 5,597 people in primary care surveillance. For the detection of SARS-CoV-2 virus, 1,860 people were studied yesterday in Cuba. As a result of the study, 52 tested positive for a 2.8% of the samples. Our country accumulates now a total of 32,276 studies of samples, and 1,189 have tested positive for 3.7% of the samples processed. Of the 52 new cases confirmed, all were Cubans. 43 were contacts of confirmed cases, and in 9, the source of infection could not be established. The largest percent of people who tested positive were male, with 59.6%. 63.4%, a figure that is higher than the one reported yesterday. 63.4% of the people who tested positive were asymptomatic. Of the 52 diagnosed cases with COVID-19, the age group with the most cases is the one from younger than 40 years of age, with 26 cases, followed by the age group from 40 to 60 years with 20 cases. The province with the most cases was Havana, with 84.6% of the cases that were reported yesterday. Of the 1,189 patients diagnosed with COVID-19 in our country, 790 show stable clinical condition. 40 people have died. We have to report today again 2 additional deaths. We have the 2 patients that were evacuated several days ago and 341 cumulative releases from hospitals. On Tuesday, 34 people were discharged. This means that 28.7% of the patients who have been confirmed in our country have already recovered. Of those discharges, the highest number is from Havana with 127, Villa Clara with 76, Camagüey with 31, Matanzas with 33, and Pinar del Rio with 25 discharges. All the provinces have discharges except Guantanamo and the special municipality of the Isle of Youth. Today we're reporting 9 patients in critical condition and 7 in serious condition. That is 1 additional patient in critical condition and 3 fewer patients in serious condition. With the number of people, with the number of fatalities that we have accumulated today, we have a fatality rate of 3.36%. As I said earlier, we have to report the passing of 2 people diagnosed with COVID-19. One is an 84-year-old male Cuban patient from the municipality of Cárdenas in Matanzas. He was a contact of a COVID-19 confirmed patient who had died earlier. This person had a vascular dementia and a respiratory sepsis. He was admitted in the Mario Muñoz Hospital, and after several days of evolution, his clinical condition worsened with an acute respiratory insufficiency. He made a respiratory arrest, and it was not possible to save his life. This patient had been reported as in critical condition in previous day. The other fatality is an 84-year-old Cuban patient from the Santa Clara nursing home with a history of high blood pressure, heart failure, diverticular disease of the colon, who was admitted to the Manuel Fajardo Hospital in that city. He was already in his 3rd day of intensive care. All efforts possible were done to save his life, but the worsening of his clinical condition did not allow him to survive, and he died yesterday. These are the 2 fatalities that we have regrettably to inform you today. The first question is from Agence France Presse. What stage of transmission of COVID-19 is Cuba at? Are we still in the controlled indigenous transmission? Or due to the number of daily cases in which the source of infection is not clear, are we already in an epidemic phase? How should we act? We are still in the phase of limited autochthonous transmission, and we maintain it regardless of the fact that many of the restrictive measures adopted already correspond to the next stage. The current stage, as it is established in the world, is applied when cases appear in our country in which it is not possible to establish links with a patient from infected areas or with a confirmed patient, and which are limited to small groups in localities or institutions in the country, which is what we call events in some provinces, in some municipalities, but which are still limited in their scope. Our population should have no doubt whatsoever that at the moment this situation extends to municipalities, to larger territories. The 3rd phase, the epidemic stage, will be declared. However, I reiterate that our country is already taking measures that are related to the epidemic stage. And let me take this opportunity to reiterate the importance of self-responsibility. And let me take up again the words by our President Miguel Díaz-Canel yesterday when he said, and I quote, "We have to act with severity against those who continue to defy the measures that the country has adopted to counter COVID-19. Spanish news agency EFE. The mortality rate of COVID-19 in Cuba remains low, and the victims have mostly been elderly people with previous pathologies. This contrasts with cases spread in other countries where the disease has also affected and caused the death of young and apparently healthy people. How can this difference be explained? Lethality has much to do with the quality of medical care, among other things. In the information we gave today, we saw that the lethality in the world stands at 6.9. That in the Americas it is at 5.31, and that ours, of which we are not very satisfied, is at 3.36%. Our population has been informed about a group of measures, about the resources developed by our pharmaceutical industry and our scientists, and they are being applied to certain groups of population, especially the population at greatest risk, with the aim of improving innate immunity. What immunity allows you to do is that when you are faced with the virus, you can confront it and your response is stronger and you are better prepared to avoid difficulties while fighting the disease. The fact that the screening is conducted, that the surveys are conducted, and even the fact that we have a self-survey, an online self-survey, this is an important contribution so that we can find people who are in the pre-symptomatic stage, and then we can isolate those people. Note that many of the cases confirmed today were previously in the category of suspects. They were admitted, or they were also in the category of contacts. And at those times, they start receiving different treatment protocols which are established in the country, which make that when the disease begins to develop, the individual is better prepared. All these factors influence in the fact that the lethality can continue to decrease.